There's this idea I keep coming back to. Maybe you've thought of it as well. If we used to document everything by hand, flip through paper charts, track down lab results by phone or fax, why do so many of us blame the EMR for causing so much workplace frustration, especially since we have all this technology at our fingertips? I recall having 3 full-time employees in the clinic where I was working whose job it was to track down charts and either put them away or deliver them to where they needed to go, or even go on goose chases to find the lost one. Sometimes they would literally search for hours. If records were needed to be downtown for billing, they'd have to Xerox pages and then fax them. There wasn't a way to know what just happened in the emergency room, and tracking down radiology tests and labs could be painful and slow. On the surface, EMRs were a marvel, allowing multiple people across various locations to get into a chart. Now we can see a patient's entire medical history with a click. We can send messages, we can trend labs, we can e-prescribe. But maybe you've noticed the inbox never stops, and that the templates have grown longer, and that the checkboxes have multiplied. It's as if we've, traded one burden for another. And we know that that's not just anecdotal. There are studies that have confirmed after-hours EMR work causes emotional exhaustion. And who hasn't felt overwhelmed by the number of inbox messages? This, too, shows up in data. Please see the footnotes to today's program for citations. So we know this isn't in our head. The data is there. The frustration is real. And yet the EMR, for better or worse, it's not going anywhere. So today I want to talk about this paradox. What exactly is it about the digital tools that were meant to save us, that seem to contribute to burning us instead? And is there a way to use these systems differently so they actually work for us and not the other way around? I've been practicing long enough to remember paper charts, and I remember scribbling notes in tight margins, trying to decipher someone else's handwriting from other shifts and specialists. And when we switched to the EMR, I actually have to admit I was hopeful. Everything was going to be in one place. We could have custom templates, even decision support. It sounded like we'd finally get a system that would work for doctors. And some of that is true, but something else happened as well. The documentation didn't just shift, it expanded. The note became less about telling the story of the visit and more about checking every possible compliance box. And the inbox, well, as you know, it's become its own job. I don't need to tell you what it's like to do a full day of clinic and then sit down to 30 or more messages after dinner. Find yourself crafting a note at 10 p.m. wondering if you even remember the conversation you're documenting. So how do we move forward? We're not going back to paper, and we can't chart less without risking compliance. That's where I wanted to turn to someone who works in this challenging area, someone trying to make digital tools serve the clinicians who use them. My guest today is Dr. Eric Boose. He is a board-certified and practicing family medicine physician who serves as the Associate Chief Medical Information Officer at the Cleveland Clinic in Cleveland, Ohio. In that role, he's at the intersection of patient care, physician experience, and healthcare technology, helping to shape how digital tools like the electronic medical record actually work in the lives of providers and their patients. Eric, thank you so much for being here.
Well, thanks for having me.
So I wanted to start by getting a little background on what your story is with regard to how you became a doctor in the first place.
Yeah, I think it was one of those things when I was a kid in school. I always just really enjoyed science, but I also really enjoyed people and just kind of interacting with folks. And to me, putting the both of them together sounded like a great career for me. And as I went along, went through, undergrad at John Carroll University and was a bio major and pre-med and went off to Ohio State, the Ohio State University College of Medicine.
Yeah, please.
And got my degree there and did my residency in McNeil, which is in Chicago, And I've enjoyed it ever since. I really liked the variety in family medicine of being able to see everybody from infancy all the way up to geriatric care and multi-generational care. It's a little scary now. I've been practicing long enough. I'm seeing kids of kids that I took care of, so that's always a little bit sobering. But
Wow.
they also love hearing about how my kids have grown up and they remember when they were born. So it's really fun to spend those experiences with my patients as you have a longitudinal career like this.
Yeah, that's really cool. Do you remember at what point you thought, boy, I might like to actually move into some physician leadership roles?
Yeah, it was sort of interesting. I never thought I would get into my role that I have today. I had started off with many of us kind of in my cohort of like, I started all the way back from when it was paper records in the hospital and in the office. And then as I went transitioned into private practice, EHRs were sort of coming out as sort of being, they should be more efficient, easily accessible. We were kind of a little bit of an earlier adopter with that. And it was funny. I was working with the team from the EHR, and they're like, you're really good at using the system. You're good at like talking about it and teaching other physicians about it. How would you like to do a little bit of that work? And I thought, well, gosh, I never really thought about doing something like that. And then, sure enough, I did spend like a half day a week just trying to show other docs the tips and tricks of using a system to make it more efficient, because I think it was obviously very overwhelming for a lot of us to transition from paper
Yeah.
records to electronic charting.
Yeah. Hmm.
Some would say it was a bad day when you had to make that transition, right? But there was a lot of things, if you knew shortcuts, it made your life so much easier. And I was pretty good at like collecting all those shortcuts and tips. And so the next thing you know, you're doing that a half a day a week, and then you're doing it a day a week. And now I spend half my time actually working with technology to try and make the physicians have an easier life when they're taking care of patients and using the EHR to their best ability.
Hmm. I'm wondering if through your experience working with physicians, both from, when EMRs first came out and they were particularly less helpful than they are now, let's say, what kind of frustrations have you continued to see from physicians who struggle with the EMR?
Yeah, I can tell you, I remember when we first transitioned from paper records to using an EHR. It's an overwhelming thing, especially it all depends on how savvy you are with computers. The older generation above myself, they really had a hard time just even typing, right? They weren't used to keyboarding or logging in and doing all the things that you kind of needed to do. And to your point, the early versions of the EHRs was a lot of typing and data entry. There wasn't a lot of
Hmm.
shortcuts. There wasn't voice dictation to help you,
Hmm.
and we didn't use widescreen so much back then, so it was a lot of scrolling up and down to use all the tools. So it was pretty onerous. And a lot of folks struggled with the value of that, right? Of kind of like, gosh, it was sure a heck of a lot easier to check some boxes on my paper chart and handwrite out the plan and what the meds were and things,
Right.
to think about, gosh, now I got to put this data entry in a bunch of different sections. It just seemed kind of overly complicated and time consuming, right? And I think you're right. Over time, as all technologies, it's gotten better to the point that now you got widescreen, more information on one screen, less buttons to click, easier to get around. And we have tools to help you too. So you can actually just speak to it and can actually type for you now, which, for folks that had a hard time typing, that made a huge difference. Um, and I do think over time, we're starting now to see the value. I think it was hard at the beginning, but now when you have more clinicians contributing to the electronic health record, it's more information over time. Now it kind of keeps everything together so much better. You almost wonder, like, how did we keep all that together before? Because I mean, I remember with paper charts, right? You would get your letters from the specialists coming in, and you would read them and put them in the paper chart, and you'd have to handwrite every medication you were adding and subtracting all the time. I remember I did hospital work back then too, so I did kind of a little bit of everything in family medicine. And I remember going to the hospital and somebody got admitted, and I had to call my office to fax over what are their problems, what are their
Right.
medications they're on, or call the
Right.
pharmacy, what medications have they been filling, to try and
Yeah.
put the picture together. And you just think, gosh, that was so time consuming and so um, a little bit disorganized in the sense that you hope you got it all right, at the time. I don't know.
No, I think that's absolutely right. I grew up in the same generation of having transitioned from the paper to the chart, and just the trying to find the chart half the time was sometimes the battle.
Oh yeah, once that chart was lost, man, that was a bad day, right? I mean, nobody had access to it. The patients weren't happy about it, It was somebody just misplaced it or put it in the wrong, alphabetical order, and that was gone for a while
Right.
until it was figured out later. You're right. Yes.
So, years later in clinical medicine, do you see any themes about physicians blaming the EMR for how they feel at work?
Think that there's a lot of busy work and tedious work that annoys a lot of us, right? I mean, the idea that I have to put in different sections in different areas where it seems like it should just flow a little better, right? And I should be able to enter things a little better. I think there are tools that are coming that are really helping with that, but I still think it's a big frustration. Even when a lot of us get our templates down or the way we document down and we kind of have nice shortcuts going. Yes, we can move much faster and it's more tolerable. I don't know that we love it, but it's tolerable. And now I think we can also see the benefits of having things in there because with a shared medical record now, I can see exactly what happened to the cardiologist yesterday, or I can see what medication was prescribed by orthopedics last week. Like all that's kept together. So that value is somewhat balancing a little bit of the time it takes for us to actually fill it all in. I do think it's getting better. I don't. I think um, it's interesting to kind of reflect back in the day of like handwriting prescriptions. That's always been a fun one. We actually had a downtime, and I had a newer physician working with me, and she didn't even really know how to write them out. And
No.
she said to me, "You mean you had to write the name out? And how many could you put on a prescription? You have to write it for every single one." I said, "Well, you can put 3 on there." There was this whole conversation of like, yeah, we used to come in, the patient said, "I need all 12 of these refilled," and you had to handwrite them out, or you could just have your staff help you. And so she was like, "Wow, that seems like a lot." I'm like, "Yeah, it's pretty easy now. You can e-prescribe it right out of the
That's
EHR." But so some of that, I think, if you stopped and thought about it, you'd be like, things are better in certain scenarios, right? I still think, it still takes time and everything, but the idea of you never lose a chart now, right? I mean, it's always available to you.
yeah.
You have all these extra tools to kind of help you document all the things you need to have documented. Now you can trend things and see things. And now there's even analytics in the EHR that can help you like, hey, find all my patients on this medication that got recalled pretty quickly with a few keystrokes. So that's there. I don't think we probably focus on the positive enough. We just kind of like to throw it under the bus with a lot of the negative feelings about it. But there are some things that if you stopped and thought about it, you're kind of like, wow, we have kind of come a long way. And I think the whole idea of like the patient portal messages or the my chart messages, right? We were all like, oh my goodness, who is letting the patient just send me emails at a time of the day, right?
Right.
But in the end, now you're like, you know what? It kind of is routine to the point that you're like, it's got to be nice for them not to have to worry about calling the office during business hours, waiting on hold. They can do it at night, and I can answer them back that way. And I'm not trying to chase them down to have them call me back if it's something I need to talk. So I think there's some things that have come a long way, and we're kind of accepting of it. We're used to using in other parts of our life, right? We may be sending an email off to the bank, and we may be doing other things, and so you can understand it. It just all those things have been pretty disruptive when they occur at first. I
Right.
mean, think about the technology we had to throw in place with COVID, right? So we had to go right to video visits, and most of us had never done video visits, and that's impossible to do. Take care of patients that way, and now we're all realizing like, yeah, you can actually do quite a bit of good care through a video visit, and everybody's kind of coming around with all of that. So
That's great. Have you ever thought about like if the world was according to Eric and you could redesign the whole physician electronic record relationship from scratch, what that might look like?
yeah, I think a lot of us always thought that there had to be a little bit better way than kind of having everything so sectioned off in the chart where you have to kind of click around to get to everything. It seemed like it should maybe just kind of all flow and sort of more of a social media feed, for example, or something that you're able to kind of digest it a little bit better. I do think part of my dream is that, and now we're kind of getting there with artificial intelligence and other tools, that I probably won't be the one having to do most of the typing. The computer is going to be able to do a lot of things by listening, and we're already looking at those types of softwares, right? Where it can listen to the conversation and document for me. But I see it in the future where it's going to do a lot more than just document the visit for me. It's going to be, getting my orders ready for me. It's going to be summarizing the chart because we deal with such large amounts of information now in the charts. Because again, now everybody's contributing to it, and that's a lot of labs to look through, a lot of x-rays to look through, and you don't want to miss something. So
Right.
it'd be really nice to have a tool like that that can summarize all of that, tell me what's really important, and personalize the care for this patient of like, what are things I don't want to make sure I miss when I see them next time? What are things I want to address? How can I escalate their care a bit with their medications, whatever it might be? And not taking over our job, but augmenting our job, maybe taking away some of the tedious work so that I can really just do my brain power and take care of the patient, touch them and feel them and talk to them, and not have to be spending a lot of time touching my computer, making sure that everything is kind of in the right places, you know?
Yeah, that's absolutely right. Can you think of a success story that's you feel like has actually really moved the needle on reducing burnout through smarter systems?
I do think that we're getting there with a lot of those examples. I mean, the EHRs are getting smarter about their layouts, and they even are embedding things like AI or automation to kind of make the tedious tasks a little bit better. I think there's a lot of players now in the field of add-ons, softwares you can add on to your EHR to make things better, such as ambient software, listening to the conversation, documenting. But these things, I, I I don't think we've seen a technology leap like this in quite a long time. And this AI abilities that are occurring right now are just leaps and bounds, getting better quarter by quarter. It's almost like there was this breakthrough, and now all these things are possible. And so it's going to be really interesting to see where we go with all of that. But certainly, a lot of things we've talked about already, which is documentation and organizing information for you, all these things acting like an assistant or a co pilot. I also see it, you're going to be able to start being able to ask it questions, kind of like, could you tell me what would be the next best medication for this patient's diabetes with their formulary coverage and their insurance and their other medications?
Mm.
And it'll provide you with suggestions. Can you help me write an appeal letter of why I feel like this patient needs this particular therapy over another? Those sorts of things are going to be pretty valuable too, cutting back on time of authorizations and the busy work of stuff that, you know, take a lot of time during the week. Besides documenting, we're doing all this other stuff, right? All the non face to face care we provide every day.
Well, right. And even the time it takes, the cognitive burden it takes to clear a space in your head to write a letter while you're seeing patients back to back to back. I think that
Mhm.
actually sounds quite helpful.
Oh
uh,
yeah, yeah. Just the preparation for some of that stuff of being able to talk to it and have it kind of create stuff for you, which is really great.
I wonder if you'd share a little bit about what it was like for you to go from however you were documenting, typing, or dictating to trying the AI scribe.
I think when we were fortunate here at the Cleveland Clinic to be able to kind of start trying out several different ones. Now, there's quite a few on the marketplace right now because I think again the software has kind of come out leaps and bounds with this AI capabilities. I think we're a little skeptical, right? Like, how could something be listening to the conversation between me and a patient, which could involve medical care, personal chit chat, could
Hmm.
be anything, could be
Hmm.
asking about anything. And so I thought, well, how is it going to be able to sort all that out, and not only sort it out, but then create a medical note similar to the documentation we've been used to for years and how we organize our thought process, what the plan is, act as a communication tool to the rest of the care team. So it was so fascinating to try it out, and they all kind of work the same way. They right now they all tend to be an app on a phone. So you lay your phone down and it's listening to the conversation. And then at the end, it takes that conversation, makes a transcript, and then rearranges it into this medical note. And I would say a couple of the earlier ones were a little bit more like a medical student note. Like it was pretty good, but it might have concentrated on the wrong detail of the visit, and kind of how we used to teach the medicine. It was like, yeah, that's probably not the scariest thing going on here. We really need to concentrate on this thing they mentioned. Um, but then yes, they improved even over the past couple of years. Then it went from a med student note, I would say, to an intern note, to a resident note. I would say now we're getting up to attending grade notes. And I think we were all a bit blown away, a little bit like, this is kind of incredible. It took away all that normal chit chat of like, hey, how are your kids doing? How was your trip to wherever? That all gets kind of not taken out, and then just really concentrates on the important things that are going on during the visit. So it's been a pretty fascinating journey to kind of see this. And you're just kind of like, wow, this can make my day go so much better. Like, I don't have to spend all that time creating a note from scratch. Now I'm just kind of like reviewing and editing for accuracy, maybe adding and subtracting a few things. But man, is it nice to have all those drafts ready to go for you when it's time to sit down and chart.
I actually think myself, I don't know that I could do what I do today without that tool. And I think it's really made a profound difference in the way I feel when I leave work every day.
Oh yeah. I mean, I think you talk about, burnout is real, right? And we all know that. And we're tired. Like we see a lot of patients and there's a lot of extra work going on, not face to face. Again, going back to, you're sitting down at lunch and now I got to answer 12 my chart messages, which take the same amount of concentration and medical thinking as it does seeing a patient in front of you. And then following up on the results from what you ordered yesterday. I mean, it's just a lot of work. And the documentation, the notes, I think we all, we're all pretty type A personalities, right? We went through med school. We're kind of like, we want to have everything kind of buttoned up and looking really nice. And so I actually had heard about a really unique way of presenting this kind of documentation process, and that I think we're all a little too hard on ourselves a little bit on that. It's got to be perfect looking. The notes got to be just so. And I think it goes back to, that's just, in the past, somebody was looking at it, right? You're an intern and a resident's judging you and attending's judging you. And I'm like, we're all attendings now. Why are we worrying about that? Our notes are exactly perfect. And it was described as like, they can really just be a B plus note. Like they got to just have what went out of the visit. You covered everything, the important things, and what's the plan, right? So it can be like they'd say a B plus note. It doesn't have to be an A plus note. Our care needs to be A plus, of course, right? But the note itself just has to reflect the basics of it all. And so, sometimes I think the adjustment of kind of like the AI producing the note, it's like, well, it doesn't sound exactly like me, or it doesn't have it listed exactly how I had my notes written. I'm like, but is it there? Does it say what you would have done? Does it, is it showing the care that you provided? And you're like, well, yeah, but I just wouldn't normally, use a pronoun instead of the first name or whatever it was. I'm like, that's fine. Like, I think people get a little hung up on that. And I think this is when it's really going to help, because I think we're all, again, we're tired. Like, it'd be nice to have all these notes done. And do they have to be absolutely perfect? No. Do they have to be good? Of course. And so if AI can produce good, then I say we go for it. It's been, but I've been using it just like you have now too. And it's like, I don't think I could go back. Like I remember I was going to the office and I forgot my cell phone and I almost had a heart attack and I turned around and got my phone. I'm like, I can't go through the day without that. Like, I'm not going back to the old ways. And I can just anticipate this stuff's going to get better and better, right? It's going to be helping us answering my chart messages and phone calls, and providing education to the patients. So they don't have to ask us questions because now they have this extra care and help with that stuff.
Yeah. I want to pivot a little bit to an area that I've heard my colleagues through the years talk about as contributing to burnout. And that's that because the EMR is portable, a lot of times they're spending time after work doing work. And, you'll hear it called pajama time and stuff like that. And I'm just wondering what kind of things your institution has done to identify, or if they've identified that, or put into place any kind of tools to help unburden people from that.
Yeah, it's a tough problem, I think. I mean, that's what's nice about technology and a downfall of technology is you can really be connected at any time, right? So the idea of me having my phone with me and I can access the EMR anytime, does that mean I'm supposed to be answering my chart messages Friday night at a football game? We do kind of track those things at the Cleveland Clinic as well to kind of understand like how much time are our clinicians spending after hours when they should be enjoying life and not being more burned out trying to get everything done throughout the day. We see promising results with increased technology helping them, such as ambient technology and other things, but it's still, there's lots of work to be done. We could be doing it all day, every day, right? I mean, we could go through all of our results on a Sunday afternoon. Sure, we could do that. But I think the idea of setting some boundaries for all of us, and some of that has to be self-inflicted boundaries of like, you know what? I need to have a break from all of this. I mean, we've all been on vacations where we truly disconnected and you get back and you're like, I feel like a whole new person. Like I just needed a break for a week. And I have really
Right.
good partners that I trust. They can take care of stuff. Nobody, I'm not going to be fearful something's going to get missed or whatever. But I think that constant connectivity is a difficult one because a lot of folks still feel kind of obligated to check in and check on things. I mean, we care about our patients, we worry about them, and there might be one or two of something we ordered that we're really curious how we were going to do the next steps for them. But I think there's some value of self-preservation to set some boundaries there a little bit too. And so we do put things down like, if you're going to send us a my chart message, don't expect a reply for a couple business days because they're not going to be looking at this. Now, do patients still send them and sometimes think they're going to get answered? Of course they do, but there's only so much we can do along those lines. So I think that everybody does understand and respects the idea of some work-life balance. Otherwise, you're just going to get, like you mentioned, the burnout's just going to get worse. So I think it is important. I think it's something that a lot of physicians have to do themselves, though, somewhat, because like I said, you could always dip into it at any time, but I think you just need to be, you know what? I need the break for the day. I'm going to spend the time with my family, and that's going to recharge me to be able to take care of things better. I always think about how, at nighttime too, it seems like you're trying to either, I don't know, catch up on work or chart stuff, or you're just tired. It takes like 3 times as long, but man, in the morning, you can get that done in like half the time, and how much speedier you are, and your brain's just on full cylinders. Like you needed that break. So I think about that sometimes as well too. Is it's just kind of structuring your day to make sure you're as efficient as possible. So
Yeah. I definitely think the disconnect time is so important. I mean, you're missing out on family, you're missing out on friends if you're constantly trying to get the work done that you were allotted in that time. But I also note that because we do have a lot to do, we do see a lot of patients, we do have a lot of documentation. Coming back in the morning and seeing that inbox with 30 things in it is it's overwhelming. I I wonder, without any data, how many people really fear that in the morning. They dread that, and what impact that's having on their ability to enjoy what they do. I think what I'm hearing from you is that we are still empowered to set our boundaries. There is no expectation that you would work at night. You have the access, you can, but that doesn't make you, that doesn't give you that time off that you needed. And
absolutely. And I think if we ever saw a patient coming to see us talking about how they're working, after hours and on weekends and they look terrible and their blood pressure's going up and everything else, what would we say to them? You got to take care of yourself. You need to have that break from work and, take care of yourself, get some exercise, get outdoors, whatever it might be. And so we oftentimes don't take our own advice when it comes to some of that stuff. We feel like we got to be a little bit of a martyr to kind of take care of everything. I think the other thing that I think a lot of us don't do, and I'm still adjusting to it as well, is building up some sort of a team around you. So we've been fortunate at the Cleveland Clinic that we're bringing in quite a few, physician assistants and nurse practitioners, and we kind of function more as a team, so that they are helping with some of that in basket work too. So the idea that I don't have to answer every refill, I don't have to answer every message. They are helping me. They are given a little bit of time to do that. Are we fortunate? Sure. I don't know if a lot of docs have that ability to have somebody else kind of pitching in, but if they did have a really good nurse and a really good MA, and somebody can kind of like help you prioritize or review your in basket or let you know that something looks really scary, then maybe that's something that they can help you with. And you relinquish a little bit of control. Some people, and I think we all have that too. Like, I got to look at every fax. I got to like review every, in basket message myself. I don't trust everybody else. I mean, if you give your team some information about like, hey, if it looks like everything's ready to go for their refill and they have an appointment lined up, and get it all ready for me. So all I have to do is sign the refill. I'm not like looking back to see what happened with them and all that sort of stuff. So I think we probably don't do enough of that, is kind of leveraging our team. And certainly they're busy too, but like there may be things that if they organize the day properly can help both of you guys get the work done faster. Then they're not waiting for you for like, you never took care of that med approval and the patient's called 5 times, all that stuff kind of goes through our minds at times too, which gets more worked up during the day of like, I'll get to it. I got so much going on, that kind of stuff. So yeah.
absolutely.
Yeah.
So I'm concerned about somebody who might be listening to this podcast who is just feeling absolutely overwhelmed, specifically by their electronic record interface relationship. Is there something that you would recommend to somebody who's truly stuck, truly struggling, and they feel that the root of their problem is the EMR?
Yeah. I think for folks that have been using it for a while, I would ask, when's the last time you took a refresher course with one of your support staff or from your EHR vendor or somebody? I think that if you've been on the EHR long enough, and I'm saying long enough could just be, longer than 2 or 3 years,
Hmm.
have you gone back to see what new shortcuts or things that are available to you? We are actually doing a little bit of what we call a tune-up or refresher courses in primary care right now at the Cleveland Clinic. And, a lot of us have been on the EHR for a decade, 2 decades, and we use it the same way we always did. Sure, it looks different, and sure, things were forced upon us that, it's a widescreen now and you can do more things and you learn things along the way. There are so many other things though that people just don't know about because we're busy. We don't take
Right.
the time to like sit
Yeah.
down and realize like, if I took an hour, with your EHR support specialist and was going through all the new tips and tricks that are available to you, you might be floored of like, oh my gosh, I am actually saving so much time that I didn't do before. So I do recommend kind of taking that pause, maybe taking that hour or two, which seems like a lot, but it could really save you an hour or two a week going forward because now you've tuned up everything that you use in there. Maybe your documentation templates are better, maybe your ordering of your meds are better, whatever it might be. There may be little things of like, hey, here's how to see what future appointments the patient has by hovering over here. That may be all that was like, oh my gosh, that's going to save me a minute or two every visit because now I know exactly who they're seeing and when. So I think it's difficult because, it does seem like sometimes you're banging your head against the computer and things, but I think there are probably things that can help you if you took the time to ask
Mm.
and to take a little time out of your week or your day to do it every so often, whether that's every 6 months, because sometimes these systems are upgraded, twice a year. There's probably something new and different you should know about to make your life a little bit easier. And again, leveraging your other colleagues in the office. So if it's like you work really well with your rooming medical assistant and she's really good at using the HR, have her prep a lot of stuff for you. Have her get the templates loaded for you. Have her do a bunch of stuff that can be helpful. So that way, as a team, you get through that office visit or that encounter much better.
That's great. Thank you. And finally, I want to ask you, so what keeps you engaged in doing the work you're doing?
It's interesting. Like I said, it's funny, when we switch over to electronic medical records and I started doing more and more of this work, it turns out there's actually a certification that physicians can get called clinical informatics, which is a CAQ, kind of similar to like a fellowship type program of sports medicine or something else. And I thought it was really interesting because if you had enough experience, you could take the boards. Now they actually have actual fellowships for it. And the boards were interesting. I had to take a big board review course because not only do you learn about like the idea of clinical informatics, but you had to learn stuff about database builds and all kinds of stuff that I would have never known about because I was not a computer science major or anything like
Yeah.
that in college. Um, but I think it's been a really fun experience for me because I feel like being a physician, using the product on a daily basis with my patients, I can see what doctors struggle with. I can see what can be helpful. I can see a shortcut that could be implemented that would save minutes daily for people. I mean, my thought process has always been, how do we make this easier? How can it be less clicks? So I think it's very important in the areas that there is some clinical leadership involved in the technology that you're going to be using because, you know, a computer science major can have all the best ideas in mind, but if they're not actually a physician actually doing the work and understanding the workflow and how it all goes, I'm not so sure they can kind of really be guiding it along the way. It's nice to work as a team of like what's possible, what would be great about it. I mean, what's been super interesting now is with all these advances in technology, I feel like we're actually in a good way going backwards where I can actually sit and look at my patient and talk to them and not be
Yeah.
stressed about taking notes anymore,
Yeah.
jotting things down. Like, just tell me what's going on. Let me ask you more questions. I don't have to record every question the answer because now the ambient listening technology is doing it for me and it has it ready to go. And that's so less stressful. The patients are loving it too. They're like, oh my gosh, it's nice to see your face the whole time, not buried on the screen or trying to take notes in the computer. It's really been quite a breath of fresh air to kind of return back to some of the basics of why we went into medicine to begin with.
There are days, for all the best intentions, you are off, you are late from patient one, and it just backs up and you've got a full day. And I used to hate those days because I knew that it was going to take a whole lot of trying to recreate those histories and go back and finish notes. And with the AI scribe, I really am confident that everything I said was there, and I just need to edit it, like you said. And the kind of cognitive burden that has released from me has been huge.
Yeah, I mean, kind of going back to like, what advice would you give to somebody who's just really done with the EHR is to actually investigate these technologies. You can actually use these ambient listening technologies in lots of um, different ways. So if your organization doesn't provide it for you, you can, get it on your own. If you're in private practice, certainly you can get it on your own. The cognitive load that comes off of you, the happiness that comes back in practicing medicine, I would say, don't be worried to kind of look outside your EHR for things that can help you with this because it's really been changing a lot lately, and that could really change your outlook. I mean, we've seen physicians saying, I'm not I can actually put off retirement for a couple more years because some of this joy is coming back. I can not cut back to part-time and still work full-time because now I have this tool that's helping me so much. So that would be the other thing I would add for those folks out there that are really kind of struggling with like the way things are today, because we've all been there and we've all had those bad days that you just mentioned. And sometimes I have to tell me every Monday, I'm like, today is Monday. Monday is the worst. I just have to get through the day. Tuesday is better. And sometimes that helps me get through the day because Mondays are, if you ask me, the worst. So
Yeah.
yeah.
I want to
Close by Fridays, but Mondays are the worst. So yeah.
It's been a great conversation, and I really want to thank you for your time and your insight. And I hope that you continue to do what you're doing and help us who are out in the field seeing our patients.
Yeah, it was great talking with you today. It was really fun to kind of reflect on the changes that have gone on in medicine and technology over the years, for sure.
This conversation reminded me that while technology created some of this mess, it's probably even ultimately a big part of the solution. But only if we start to ask different questions, not just how fast can I finish my notes, but how connected can I feel to the work that I'm doing? The future isn't about getting back to paper charts, and I think that's okay. Every advancement that holds the potential to free us back up to do what we love is a good thing. Seeing patients is what we love. I want to thank Dr. Eric Boose for his time and insights. If this show sparked something for you, please share it with somebody who's drowning in their inbox or someone who finds the EMR to be an impediment. I invite you to leave comments as well. Thanks for listening to another episode of Heal the Burn. This is Dr. Steven Sears, and I'll talk to you soon.